6 out of 10 Americans have at least one chronic disease. 4 out of 10 have two or more. Most chronic diseases are not caused by a deficiency of medications. They're caused by long-term dysfunction in underlying biological systems. People don't ignore prevention because they don't care. They struggle because the brain prioritizes now over later. Pills can manage disease, but changing lifestyle is what changes the trajectory of disease. So when behavior changes, biology follows.
Welcome back to The Young Lab, the show where internal health, performance, and regenerative aesthetics come together under one evidence-based framework. So far this season, we've talked about why inside-out human optimization matters, what's possible when biology is treated correctly, and the health span equation that determines how long we stay well. Today, we're addressing something even bigger, the way medicine itself is practiced. Dr. Young, this episode is about the lifestyle medicine revolution and why prevention consistently beats everything. So it's so good to see you again and be back in the Young Lab. How are you doing today?
I'm doing great. It's great to be back. How are you doing?
Doing well, doing well. I'm excited to jump into this episode. So I know lifestyle medicine is a term that people hear more often now than ever before, but I feel many of us don't really understand it. So how do you define lifestyle medicine, and how is it really fundamentally different from traditional medical care?
That's a great question. Lifestyle medicine isn't a trend. It's a response to what the data and clinical experience are telling us. So right now, 6 out of 10 Americans have at least one chronic disease. 4 out of 10 have two or more. So most of these conditions driving healthcare today are type 2 diabetes, heart disease, hypertension, obesity. They don't appear suddenly. They develop slowly over years as a result of how we eat, move, sleep, manage stress, and recover. Lifestyle medicine is the branch of medicine that focuses on changing those upstream drivers, not just managing the downstream consequences. So for context, I'm double board certified in family medicine and lifestyle medicine. So I practice traditional clinical medicine while also being formally trained in using lifestyle interventions as therapeutic tools. Not suggestions, not wellness advice, but treatments that measurably change physiology. So in practical terms, lifestyle medicine uses evidence-based interventions like nutrition, physical activity, sleep, stress management, avoidance of harmful substances, and social connections as first-line therapy to prevent, treat, and in many cases, reverse chronic disease. There is a professional medical organization that we belong to, the American College of Lifestyle Medicine. They train and certify clinicians in this approach. But the most important thing for listeners is that this isn't theoretical. We have decades of data showing that regular physical activity improves insulin sensitivity and lowers cardiovascular risk. Whole food dietary patterns reduce inflammation and improve cholesterol profiles. Poor sleep alone increases the risk of obesity, diabetes, depression, and heart disease. Chronic stress directly raises blood pressure and inflammatory markers. So traditional medicine is extraordinary in acute care. If someone has an infection, trauma, or heart attack, modern medicine saves lives. Where lifestyle medicine differs is timing and focus. Instead of waiting for disease to declare itself and asking what medication lowers this number, lifestyle medicine asks, why is this number abnormal in the first place? It intervenes earlier at the level of metabolism, inflammation, muscle mass, vascular health, and nervous system regulation. And this is when biology is still flexible. It doesn't replace medications, and in many cases, lifestyle medicine makes medications work better, allows for lower doses, or helps prevent the need for them altogether. So lifestyle medicine isn't alternative care. It isn't anti-pharmaceutical. It isn't about perfection. It's modern data-driven medicine practice upstream, where we have the greatest opportunity to change health trajectories, extend health span, and improve quality of life.
Absolutely. And Why do you think that modern medicine has become so good at really managing diseases once it exists, but so limited when it really comes to actually preventing it in the first place?
So, this really comes down to how modern medicine was designed. It's not a lack of intelligence or effort. Our healthcare system was built to treat acute illnesses, infections, trauma, heart attack, strokes, like we said earlier. And in these situations, modern medicine is extraordinary. But the diseases now driving healthcare are chronic, and they develop very differently. Right now, 6 out of 10 Americans have one chronic disease, and 4 out of 10 have two or more. And the major driver of that burden is excess adiposity and metabolic dysfunction. And what's changed recently, and this is important, is how we define obesity. For decades, obesity was classified entirely by BMI or body mass index, a simple height to weight ratio. BMI was easy to use, and really it was designed to measure size, but it was never a great measure of health. For instance, it doesn't tell us where fat is stored, how much visceral fat someone has, whether muscle mass is preserved, or whether metabolism is healthy. And because of that, major medical organizations now recognize obesity as a chronic relapsing disease of adiposity and metabolic dysfunction, not just excess body weight. Instead of relying on BMI alone, clinicians are now encouraged to assess visceral fat, insulin resistance or prediabetes, blood pressure, lipid abnormalities, fatty liver disease, muscle mass and functional capacity, cardiorespiratory fitness. So what this means in practical terms is that many people who were previously labeled overweight now meet criteria for obesity based on metabolic health, even if their BMI stays at their normal or slightly overweight. And when these newer criteria are applied, estimates suggest that 60 to 70% of adults will qualify as having obesity or obesity-related chronic disease, not the 42% identified by BMI alone. So that reframes the problem entirely. These individuals are not waiting to get sick. The biology drives diabetes, heart disease, hypertension, arthritis, sleep apnea, and even certain cancers is already present. And this is where reactive medicine struggles. Most of these metabolic and inflammatory changes develop years to decades before diagnosis. So insulin resistance often precedes type 2 diabetes by 10 to 15 years. Atherosclerosis, which is a buildup of plaque in the blood vessels, begin long before a heart attack. So fatty liver disease often exists silently for years. But our healthcare system typically intervenes after diagnostic thresholds are crossed, once numbers are high enough to label a disease. So all of this is really a timing problem, not a technology problem. The economic data reflects this delay. The United States now spends $4.7 trillion per year on healthcare, and that's about 18% of our gross domestic product, or GDP. And nearly 90% of that cost is spending tied to chronic illnesses or chronic disease. But despite this investment, the United States continues to lag behind other high-income nations in life expectancy, health span, and preventable deaths. A gap repeatedly documented by organizations such as the Economic Cooperation and Development Organization. So the limitations of reactive medicine are this: we wait too long. So we intervene after metabolic dysfunction, inflammation, muscle loss, and poor sleep have been present for years and sometimes even decades. So lifestyle medicine challenges that model by shifting when we intervene. It focuses on the biology that exists before disease is diagnosed, when the body is still highly responsive to change. So reactive medicine manages disease once it exists. Lifestyle medicine intervenes earlier when prevention is still possible. And as our definitions of obesity and metabolic disease evolve, it's becoming increasingly clear why prevention can't be optimal anymore.
Absolutely. And I know you shared your Ghana mission trip story before at a previous episode. So looking back now at that experience, how did it really crystallize the limitations of medicine first care? Or medication first care?
Well, for listeners who may not have heard the story before, this was early in my medical career when I traveled to Ghana for a medical mission. So like most clinicians, I went in expecting to treat infectious diseases, malaria, parasitic infections, things traditionally associated with that part of the world. But once clinics started, that's not what we saw. Instead, we were treating the same chronic illnesses I was seeing back in the United States. And, we're talking about type 2 diabetes, hypertension, dyslipidemia, cardiovascular disease. And at first, it didn't make sense. These weren't supposed to be Western diseases, especially not at the scale, and especially not in rural Africa. What changed my perspective was paying attention not to just what was happening inside the clinic, but what was happening outside of it. If you look, there were billboards for soda and sugary drinks, advertising for packaged and unprocessed foods. There were tons of Western fast food chains. So the traditional diets and daily movement patterns were being replaced by sedentary and processed lifestyles. What I didn't fully understand at the time, but what global data now makes very clear, is that I was watching lifestyle-driven disease being exported in real time. So according to the World Health Organization, more than 70% of deaths worldwide are now caused by non-communicable diseases, meaning heart disease, diabetes, cancer, and chronic lung disease. And the fastest growth in these conditions is happening in countries as they adopt Western dietary patterns. Often, this occurs within one generation. So clinically, the hardest part of that experience wasn't a lack of medications. We had medications. We could lower blood pressure. We could lower blood sugar. But we also knew something deeper. Once we left, the environment creating the disease would still be there. That's when the limitations of medication first became clear, very clear to me. Medications treat the downstream markers of disease, glucose, blood pressure, cholesterol, but they don't fundamentally change the upstream biology driven by nutrition quality, physical activity, sleep, stress, and social environment. So what reframed my thinking and gave me real hope is that we've seen the opposite pattern as well. This is where the blue zones come in. Blue zones are regions of the world where people live longer, but more importantly, they live healthier and with far less rates of chronic disease and disability. These regions include Okinawa, Sardinia, the Nicoya Peninsula, Icaria, and Loma Linda, which is right here in the United States. What's striking is that these populations don't share a single gene, supplement, or medical system. What they share are consistent, reportable lifestyle behaviors, which are like whole, minimally processed foods, largely plant-based, daily movement built into life. They don't have a programmed workout, and they have strong social connections and a sense of purpose. They sleep regularly and they have structured rest. They have very low exposure to tobacco, excess alcohol, and ultra-processed foods. Loma Linda is especially important. It's recognized as a blue zone. This is a city in Southern California that is surrounded by the same healthcare system, food supply, and cultural pressures as the rest of the United States. Yet, these people live 7 to 10 years longer than the average American. They experience significantly lower rates of heart disease, lower rates of type 2 diabetes, lower obesity rate, and reduced risk of certain cancers. And the reasons aren't genetic. The longevity advantage in Loma Linda is largely driven by the lifestyle patterns of the people there, which are the Seventh-day Adventist church community. This is important because the SDA population has been studied extensively for decades. Large cohort studies show that Adventists who follow a predominantly plant-based diet live 4 to 10 years longer than non-Adventists living in the same region. Vegetarian Adventist men live about 7 years longer than the average American male. And vegetarian Adventist women live about 4 to 6 years longer. So they also have up to 50% lower rates of ischemic heart disease, significantly lower rates of hypertension and diabetes, and lower all-cause mortality, meaning you die from anything. And this isn't because they're extreme, it's because their lifestyle patterns are consistent. The Seventh-day Adventist framework emphasizes whole food, plant-forward nutrition, regular moderate physical activity, avoidance of tobacco and alcohol, and they prioritize sleep and weekly rest. They also have a strong community and a shared purpose. So from a medical standpoint, this matters because these behaviors directly influence physiology. Insulin sensitivity improves, inflammation decreases, blood pressure and lipids normalize, mitochondrial function improves, and cardiometabolic risk drops dramatically. But here's the most sobering lesson from the blue zones. Their advantage is not permanent. So as traditional lifestyles erode, the longevity advantage disappears. I mean, we have the data to prove it. In Okinawa, once home to the highest number of centenarians, meaning people who live to be over 100, they have the highest number in the world. Younger generations have shifted toward ultra-processed foods and sedentary living. As a result, obesity rates have risen sharply. Type 2 diabetes rates now resemble mainland Japan, and life expectancy gains have stalled or declined in younger cohorts. And we see the same thing in Sardinia, Icaria, and Nicoya. As legumes, vegetables, daily movement, and social rituals are replaced with refined carbohydrates, packaged food, and sedentary behavior, cardiometabolic disease rises. Hypertension and diabetes become common, and the younger generations lose the longevity advantage of their parents and grandparents. And this is the key insight. The loss of longevity happens within 1 to 2 generations. That tells us something fundamental. These benefits are not genetic. They are behavioral and environmental. So when behavior changes, biology follows. So my experience in Ghana crystallized something for me. Medicine can't just be about managing disease once it appears. It has to intervene earlier. And this is when metabolism, inflammation, muscle mass, and cardiovascular functions are still adaptable. That realization is what ultimately pulled me toward lifestyle medicine. Not because it's idealistic, but because it's evidence-based, scalable, and aligned with how human physiology actually works.
Absolutely. And I think that there's a common belief that if something's wrong, there must be a pill for it. So why does thinking like that break down when it comes to chronic disease and aging?
This is where understanding how chronic disease actually develops becomes pretty critical. Medications are often very effective at lowering measurable markers like blood sugar and blood pressure, cholesterol. And in many situations, they're absolutely necessary and life-saving. But most chronic diseases are not caused by a deficiency of medications. They're caused by long-term dysfunction in underlying biological systems. From a physiology standpoint, chronic disease is typically driven by a few core processes, and those are like insulin resistance, chronic low-grade inflammation, loss of muscle mass and metabolic capacity, mitochondrial dysfunction, poor sleep and circadian disruption, and chronic activation of the stress response. So medications usually act downstream. They improve the output of these systems, the numbers we measure, but they don't change the inputs that created the dysfunction in the first place. And we can see this in the data. So take type 2 diabetes. Insulin resistance often develops 10 to 15 and sometimes 20 years before diabetes is ever diagnosed. By the time blood sugars cross the diagnostic threshold, the disease process has been evolving for over a decade. Even with modern medications, and including insulin, fewer than half of people with diabetes achieve optimal metabolic control long term. So glucose numbers may improve, but the underlying metabolic dysfunction, insulin resistance, visceral fat accumulation, mitochondrial stress often remains. And then we look at cardiovascular disease. It follows the same pattern. Statins and blood pressure medications clearly reduce risk, and that matters. But despite decades of widespread use, cardiovascular disease remains the leading cause of death worldwide. And this is according to the World Health Organization. And that's because atherosclerosis, or the plaque in the arteries, doesn't begin at the moment of a heart attack. It often starts decades earlier, sometimes even in childhood. We have found in studies of young people who died prematurely that they've already started to develop fatty streaks in atherosclerosis. And we're talking about individuals who are 17, 18, 19 years old. And all of these things are typically driven by inflammation, insulin resistance, poor diet quality, inactivity, sleep disruption, and chronic stress. And this is long before medication ever enters the picture. So hypertension is another clear example. Nearly half of United States adults meet criteria for high blood pressure, yet only 1 in 4 have it adequately controlled, even with medication. So why is this? Because blood pressure isn't a pressure issue by itself. It reflects vascular stiffness, visceral fat and insulin resistance, kidney and sodium handling, sleep apnea, and nervous system tone. So medications help, but only partially address those upstream drivers. When you zoom out, the pattern is unmistakable. Despite decades of increasing medication use, obesity rates continue to rise. Type 2 diabetes rates have more than tripled since the 1980s. And multimorbidity, that means living with multiple chronic diseases, has become the norm. This doesn't mean medications don't work, it means that they work downstream. So lifestyle interventions work upstream, and the data here is compelling. So regular physical activity reduces the risk of developing type 2 diabetes by 30 to 50%, even without weight loss. Whole food, minimally processed dietary patterns reduce cardiovascular events by 10 to 30%. Improving sleep duration and quality lowers the risk of obesity, diabetes, depression, and heart disease. Sustained lifestyle interventions can delay, reduce, and in some cases, eliminate the need for medications over time. Biologically, this makes sense. Lifestyle changes improve insulin sensitivity, reduce chronic inflammation, preserve and rebuild muscle mass, improve mitochondrial efficiency, and regulate the stress response. The bottom line, this isn't an anti-medication argument. Medications are powerful tools, but for lifestyle-driven disease, they're usually supportive tools, not curative ones. When lifestyle forms the foundation and medications are layered on thoughtfully, outcomes improve, better disease control, fewer complications, and often fewer medications over time, and better quality of life. Pills can manage disease, but changing lifestyle is what changes the trajectory of disease. And that's why when it comes to chronic illness, addressing root cause consistently beats every pill.
Absolutely. And when you practice lifestyle medicine, what are the core pillars that you really focus on before you ever even think about prescriptions?
Okay. So when we talk about pillars in lifestyle medicine, what we're really describing are the core inputs or tenets that regulate human biology every single day. These inputs determine whether the body spends more time in repair or breakdown, balance or inflammation, resilience or vulnerability. And this part matters for listeners. So chronic disease usually doesn't come from one bad choice. It comes from years of small, repeated biological signals pushing the body in the wrong direction. So lifestyle medicine focuses on pillars because they allow us to change those signals at the source. So there are 6 or 7 pillars, and none of them require perfection. They require consistency. So the first pillar is nutrition. Nutrition is often where people think lifestyle medicine starts, and for good reason. Food doesn't just provide calories. It sets the internal metabolic environment. So every meal influences blood sugar stability, insulin signaling, inflammatory pathways, gut microbiome composition, and hormones that regulate hunger, energy, and fat storage. So from a global perspective, poor diet quality is now linked to more deaths than smoking, largely through heart disease, diabetes, and cancer. Diets high in ultra-processed foods increase insulin resistance, systemic inflammation, and visceral fat, even when calorie intake is controlled. So in contrast, diets centered around whole, minimally processed foods improve insulin sensitivity, lipid profiles, and inflammatory markers within weeks to months. So this isn't about restriction or labels, it's about upgrading inputs. More whole foods, more fiber. Most adults get less than half of what they need, making sure that you have adequate protein for muscle repair and taking in fewer ultra-processed foods. So small changes often produce measurable improvements in energy, labs, and weight within 4 to 8 weeks. So the next pillar would be movement, and this may be the most powerful yet most underestimated intervention in medicine. So fitness isn't about appearance, it's about physiologic capacity. One of the strongest predictors of early death isn't body weight, it's low cardiorespiratory fitness. It improves glucose uptake by muscle independent of insulin, vascular flexibility and blood pressure, oxygen delivery and mitochondrial efficiency, and autonomic nervous system balance. So regular physical activity can reduce all-cause mortality risk by 30 to 40%, even if weight never changes. So how do you make these changes? So move daily, walking counts, combine aerobic activity with resistance training, focus on consistency, not exhaustion. Movement teaches the body how to handle metabolic and physical stress more efficiently. Another pillar would be muscle. Muscle deserves special attention because unless we actively preserve it, we lose 3 to 8% per decade after age 30, and the rate accelerates after 50. Muscle isn't cosmetic, it's a major metabolic and endocrine organ. Muscle clears glucose from the bloodstream, it improves insulin sensitivity, it releases myokines that reduce inflammation, it protects against frailty, falls, and loss of independence, and it supports brain health and immune resilience. So low muscle mass and strength are strongly associated with higher hospitalization rates, increased disability, and early mortality, independent of body weight. So things that you would want to do is that you want to make sure that you're participating in resistance training at least twice weekly. Make sure that you have adequate protein intake. Reframe strength as protection, not aesthetics. So preserving muscle is one of the most powerful longevity strategies that we have. Another pillar would be sleep. Sleep is an optional recovery. It's a biological reset. So during sleep, insulin sensitivity improves, appetite hormones normalize, the brain clears metabolic waste, immune surveillance resets, and tissues repair. Even short-term sleep restrictions, even a few nights, can worsen blood sugar control and increase inflammation. So people who consistently sleep fewer than 6 hours per night have markedly higher risk of obesity, type 2 diabetes, cardiovascular disease, depression, and cognitive decline. So you want to make sure that you treat sleep as a priority. Keep consistent sleep and wake times, protect that hour before bed, and address sleep apnea and insomnia early. Better sleep amplifies every other pillar. The next pillar would be stress management. So stress itself isn't the enemy. The problem is chronic stress without recovery. When the stress response stays activated, cortisol levels remain elevated, blood pressure increases, inflammation accelerates, digestion and sleep suffer as well. So over time, this drives cardiometabolic diseases and accelerates aging. So you want to make sure that you build daily stress down practices such as breath work, movement, time outdoors, or stillness. Schedule recovery like you schedule workouts. The goal isn't eliminating stress, it's teaching the nervous system how to stand down. So the last pillar would be the avoidance of hazardous substances. Tobacco remains the leading preventable cause of death and shortens life expectancy by 10 years.
Wow.
Alcohol increases the risk of hypertension, atrial fibrillation, liver disease, and several cancers, even with moderate intake. Environmental toxins add another layer of inflammatory and metabolic stress. So you want to make sure that you eliminate tobacco and nicotine. You want to reduce alcohol. Even modest reductions improve blood pressure and sleep. Minimize unnecessary toxic exposures when possible. We have another pillar, and that would be social connection and purpose. Humans are biologically wired for connection. When people feel isolated, the body interprets this as danger. So you get an increase in stress hormones, inflammation increases, immune function declines. So loneliness is associated with about a 50% increase in early mortality. This is similar to smoking. Strong relationships and a sense of purpose send the opposite signal, safety. So invest in relationships intentionally, build routines that include others, cultivate purposes beyond health metrics. So connection improves resilience in ways no medication can replicate. So each pillar, and bringing this all together, each pillar is powerful on its own, but together they're transformative. Better sleep improves nutrition choices. Movement improves insulin sensitivity and stress tolerance. Muscle supports metabolic health. Connection makes change sustainable. So lifestyle medicine isn't about doing everything at once. It's about stacking small, sustainable changes that shift biology over time, away from disease and toward resilience. That's how patients move from reacting to illness to actively shaping their health span and aging trajectory.
That's so interesting. And I know you've been really clear that nutrition is foundational as well, but you've also been very careful to not be ideological. So, how do you approach nutrition clinically without really turning it into dogma?
Nutrition is confusing largely because we've turned it into a debate about diet identities instead of focusing on how the human body actually responds to food. In lifestyle medicine, we don't start with labels like vegan, keto, paleo, or carnivore. We start with a much simpler and more useful question. What patterns of eating does human biology consistently respond well to over time? When you look at the decades of research, population studies, randomized trials, and real-world outcomes, the signal is remarkably consistent. Globally, poor diet quality is now linked to more deaths than smoking, largely, as we stated earlier, secondary to heart disease, type 2 diabetes, and cancer. In the United States, the average person now gets over 70% of their calories from ultra-processed foods. And these are foods that are packaged, highly refined, and engineered to be easy to overeat. Here's why this matters. Large cohort studies show that for every 10% increase in calories from ultra-processed foods, there is an approximately 10 to 15% higher risk of cardiovascular disease. There is a 12 to 25% higher risk of type 2 diabetes. There's an 8 to 12% higher risk of all-cause mortality. So that means going from 30 to 60% of calories from ultra-processed foods, which is really common, doesn't just slightly increase risk. That means going from 30% to 60% of calories from ultra-processed foods, which is really common, doesn't just slightly increase risk. It substantially shifts biology toward chronic disease. So ultra-processed foods increase risk when calories are similar, but because they change how the body handles energy, they tend to digest very quickly. They tend to spike blood sugars. They trigger high insulin release. They increase inflammation. They disrupt our gut microbiome or our microbiome. They tend to digest very quickly, spike blood sugars, trigger high insulin release, increase inflammation, disrupt gut bacteria or our microbiome. And over time, this combination worsens insulin resistance, promotes visceral fat gain, raises blood pressure, accelerates vascular disease. Ultra-processed foods teach the body to store energy and stay inflamed, not to use energy efficiently. Whole foods send the opposite signal. They digest more slowly, they stabilize blood sugar, they feed beneficial gut bacteria, thus creating an internal environment where the body can repair, regulate, and adapt. Another reason nutrition feels confusing is that the same food can affect different people differently. How someone responds to food depends on muscle mass, physical activity level, sleep quality, stress levels, metabolic health. So someone who is active with good muscle mass handles carbohydrates very differently from someone who is sedentary and insulin resistant. That's why lifestyle medicine avoids rigid rules. Instead of asking, is this food good or bad, we ask, is this food helping this person's biology move in the right direction right now? This is where nutrition becomes practical. Protein. We need protein to help protect muscles and metabolism. Our goal is to get 0.6 to 1 gram of protein per pound of ideal body weight per day. Protein preserves muscle mass and improves satiety. It stabilizes blood sugar. It protects against age-related decline. The closer someone is to aging, illness, or training, the more important the upper end of the range becomes. And then next would be fiber. This is typically a missing nutrient for a lot of people. The recommendation for women is 25 grams per day. For men, it's 37 grams per day. Most Americans consume less than 12 to 15 grams per day. Fiber is important because it slows digestion and stabilizes blood sugar. It lowers LDL cholesterol. It reduces inflammation, and it feeds the bacteria in our gut. It also improves insulin sensitivity. Fiber is one of the main reasons whole foods behave so differently than ultra-processed foods, even at a similar calorie level. So instead of overhauling everything at once, lifestyle medicine focuses on high-impact, sustainable upgrades. Build meals around anchors. Make sure you're getting adequate protein. Make sure you're getting fiber-rich plants, and make sure that you're getting healthy fats. And also, you need to reduce ultra-processed foods gradually. You don't need zero, you just need less. Even modest reductions improve labs and energy. Match nutrition to lifestyle. More movement allows more flexibility. Less movement benefits from more structure. Think long-term. Sustainability beats intensity. Consistency beats perfection. So when nutrition aligns with physiology, blood sugar stabilizes, hunger signals normalize, energy improves, inflammation decreases, weight regulation becomes easier. So most importantly, people stop cycling between restriction and relapse. Lifestyle medicine doesn't promise a single best diet. It offers evidence-based patterns personalized to the individual that work with the body instead of fighting it. That's how nutrition stops becoming overwhelming and becomes one of the most powerful tools we have for long-term health, prevention, and longevity.
We've been talking about how this isn't about being anti-medication at all, right? So when do medications like GLP-1s, statins, or blood pressure medicines really play an important role in your practice?
This is an important distinction to make because medications absolutely have a role. And when they're used thoughtfully, they can be incredibly powerful. So in my practice, medications are most valuable in three main situations. Number one, risk reduction. Number two, stabilization. And number three, buying time. Some patients have a high baseline risk because of genetics, long-standing disease, or advanced metabolic dysfunction. For example, statins reduce major cardiovascular events by roughly 20 to 30%, particularly in patients with elevated apolipoprotein B or established cardiovascular risk. Blood pressure medications reduce the risk of stroke by 30 to 40%. And then those GLP-1 receptor agonists reduce major adverse cardiovascular events in high-risk patients and significantly reduce progression to diabetes. So in these cases, medications are not optional, they're protective. They lower the immediate risk of heart attack, stroke, and complications while we work on the longer-term drivers. So number two, medications to stabilize the biology. If someone has very high blood pressure, poorly controlled diabetes, severe insulin resistance, advanced dyslipidemia, then lifestyle changes alone may not be enough initially. Medications can help bring physiology back into a safer range so the body can respond to lifestyle interventions more effectively. Think of medications here as guardrails, not the destination. And then the third would be medications to buy time. This is where GLP-1s are especially helpful. They improve insulin sensitivity, they reduce appetite and food noise, they promote meaningful weight loss, and improve cardiometabolic markers. For some patients, especially those with significant obesity or metabolic disease, these medications can buy time. Time to build habits, improve mobility, reduce inflammation, and regain metabolic control. What's important is that these medications work best when paired with lifestyle change. Without that foundation, weight regain and loss of benefit are common once the medication is stopped. So the key message is medications don't replace lifestyle, they support it. So lifestyle medicine and medications can work together, and they should. Medications don't replace lifestyle, they support it. Lifestyle medicine helps improve insulin sensitivity, it reduces inflammation, it preserves muscle, it improves sleep and stress physiology. As these systems improve, something powerful often happens. Medication doses can be lowered or reduced. Side effects decrease. Some medications can be de-prescribed safely. That's not failure, that's success. So, and we're not talking about being anti-medication. Being anti-medication would mean ignoring risk and withholding tools that reduce harm. That's not what this is about. This is about the right tool, the right patient, the right time, in the right order. Medications manage risk. Lifestyle medicine changes the trajectory. When both are used together, outcomes are better than either alone.
That is so important, especially really important information, especially with GLP-1s, and everyone's kind of talking about them right now. How do lifestyle medicine and modern tools like peptides, hormones, and regenerative therapies work together? And beyond that, why does order actually matter so much?
This is one of the most important concepts for people to understand right now because there's so much excitement about peptides and hormones and regenerative therapy and performance medicine. And many of these tools can be incredibly effective. But here's the key principle. Lifestyle medicine sets the biological environment. Modern therapies work inside that environment, and the order absolutely matters. So tools like peptides, hormone optimization, regenerative injections, and performance-based therapies can improve muscle recovery and strength. They can enhance mitochondrial function and energy production, and they can optimize hormonal signaling. Also, they support tissue repair and healing. They also improve body composition, cognition, and resilience. So when used in the right patient at the right time, these therapies can accelerate progress. They don't override basic physiology. They amplify whatever biologic state already exists. So if someone is insulin resistant, chronically inflamed, sleep deprived, sedentary, under constant stress, nutrient deficient, then these advanced therapies are essentially trying to push the gas pedal while the parking brake is still on. So for example, hormones don't signal properly in an inflammatory, insulin-resistant environment. Muscle building or regenerative therapies are blunted without adequate nutrition, sleep, and movement. Mitochondrial and longevity-focused therapies don't work well if the body is consistently or constantly in stress mode. This is why people sometimes feel disappointed after jumping straight into optimization tools. The foundation isn't ready. Lifestyle medicine improves the core system that all advanced therapies depend on. Nutrition improves insulin resistance, reduces inflammation, and provides the raw materials for repair. Movement and muscle improve glucose handling, hormone signaling, and mitochondrial density. Sleep regulates growth hormone, testosterone, cortisol, and cellular repair. Stress regulation shifts the body from breakdown to recovery. And avoidance of hazardous substances such as tobacco and alcohol lower toxic burden. Social connection and purpose improve nervous system balance and long-term adherence. When these systems improve, the body becomes more responsive. That's when the modern therapies start to work better, faster, and more predictably. And here's the simplest way to think about it. Lifestyle medicine is the foundation. Longevity and regenerative therapies are accelerators. Performance medicine is refinement. If you skip the foundation and go straight to acceleration, results are often inconsistent, short-lived, more expensive, or just totally underwhelming. So when you build in the right order, lower doses are often needed. Results are more durable, side effects are reduced, and progress compounds instead of stalling. This isn't about denying people access to advanced tools. It's about making sure those tools actually work. The encouraging part for listeners would be this. You don't need cutting-edge therapies to start improving health today. Lifestyle changes alone can improve metabolic health. They can slow biologic aging. They can increase energy and resilience. And if or when advanced therapies are layered in, they work far more effectively because the body is ready. Lifestyle medicine and modern therapies aren't competitors, they're partners, but in the right sequence. Lifestyle medicine builds the foundation, modern therapies accelerate progress, performance medicine fine-tunes the results. That order is what turns short-term optimization into long-term health and longevity.
If prevention is so effective, why do you think that so many people really struggle so much to really invest in it before it breaks?
This is such a human question. And honestly, it's not a failure of motivation or intelligence. It's about how we're wired. Humans are very good at responding to immediate threats that kept us alive. If there was a tiger that was going to pounce on us, we need to know. But we're far less effective at acting on future risk. Pain, symptoms, and crisis demand attention. Prevention is quiet. When something breaks, you have chest pain or a scary lab or a diagnosis, the signal is loud and urgent. But prevention asks us to act today for a benefit we may not feel for years. And the human brain is just not wired that way. From a psychology and neuroscience standpoint, a few things are happening. First, delayed rewards don't motivate us as well. Eating better, sleeping more, or exercising doesn't always produce instant feedback, especially early on. Second, we're influenced by normalization. When everyone around us is tired, stressed, overweight, or on medications, it starts to feel normal, even when it's not healthy. Third, modern medicine unintentionally reinforces this pattern. We're trained to wait for a diagnosis, then react. So people assume if there really is a problem, someone will tell me. But by the time something breaks, the process has usually been going on silently for years or decades. So one of the biggest barriers to prevention is that early chronic disease often has no symptoms. So you can have insulin resistance, early vascular disease, sarcopenia or muscle loss, worsening metabolic health, and you can still feel fine. And so people reasonably think, why invest time, energy, or money into something if I don't feel sick? The challenge is when these symptoms finally show up, the disease is often well established. Another reason that prevention is hard is how we frame it. Prevention feels like time, effort, inconvenience, cost, whereas treatments feel justified because something is already wrong. But the data consistently shows that chronic disease is far more expensive financially, physically, and emotionally than prevention ever is. The problem is that prevention asks us to pay up front while treatment spreads the cost over time. So here's what I've seen change in patients, which is very encouraging. Prevention becomes meaningful when people stop thinking about it as avoiding disease and start thinking about it as protecting function. So people care deeply about energy and they care about their independence. They care about their mental clarity. They care about being present for family. They want to make sure aging is without losing themselves. Prevention is framed as this is how I protect the life I want to live instead of this is how I avoid a diagnosis someday. It becomes much easier to invest in. What's encouraging is that people are starting to connect these dots. We're seeing a shift toward measuring health early, talking about health span, not just lifespan, valuing vitality, not just survival. And once people experience even small wins, better energy, better sleep, better labs, prevention stops feeling abstract. It becomes personal. People don't ignore prevention because they don't care. They struggle because the brain prioritizes now over later. Early disease is silent. The system rewards reaction over prevention. Lifestyle medicine helps bridge that gap. It makes prevention visible, measurable, and meaningful before something breaks. And when people realize that they can influence how they age, how they feel, and how long they stay independent, prevention stops being optional. It becomes one of the most powerful investments they can make.
Absolutely. And I think that this episode has really reframed medicine to imply something that many people feel intuitively, that waiting on something to break is not a health strategy. So this was such an informative episode. Thank you so much. And I'm excited for the upcoming episodes. We're going to go deeper into each pillar of lifestyle medicine, such as nutrition, metabolism, sleep, hormones, peptides, aesthetics, and mindset. So you can start practicing prevention in your own life. And if this episode changed how you think about healthcare, make sure you subscribe and stay with us. Thank you so much, Dr. Young, and thank you for all this wonderful information. We will see you soon.